Now, Deputy Colm Keaveney.
It can't have escaped the notice of government deputies that the wording of tonight's motion is almost taken word from the recent statement by Tony O'Brien, the Director General of the HSE. And Cathaoirleach, it is worth placing the words of Mr O'Brien on the record of the House for the attention of government. He is quoted in saying, "It will not be possible to meet fully all of the growing demands being placed on the health service. In particular, some service priorities and demographic pressures may not be met." Now, Cathaoirleach, the government's amendment tonight proposes to flatly contradict the Director General of the HSE. Now, I will return to Mr O'Brien later, but I'd like to address the substantive part of my contribution to the continuing failure to secure appropriate resources for the mental health sector. This, Cathaoirleach, at a time when levels of mental ill health are increasing and where many in our communities are experiencing serious, tragic and shattering levels of suicide. Sadly, our mental health services continue to be the Cinderella of the public health service. There has been a fundamental failure to build on the progress to date by previous governments, including the Mental Health Act 2001, 2008 and the full adoption of the Vision for Change 2006. Instead, the government is cherry-picking from the Vision for Change policy, selecting those aspects that they choose to do so in order to save money, dragging their feet, or ignoring those aspects of the policy that requires investment and resources. Cathaoirleach, the ongoing closure of St Bridget's in Ballinasloe is a perfect example of that. €3.1 million was recently spent on providing a state-of-the-art facility, but it's now to be closed. Instead, patients are being moved to Galway. Before an adequate unit has been identified, instead they will be temporarily accommodated in a unit that only last year came to open criticism from the Mental Health Inspectorate. The pattern, the failure to link capital spending with current spending, is to be found throughout several areas of the public health service. The decision to close St Bridget's was taken on the back of a very curious process that seems to be designed to deliver a decision that had already been made by the Minister. This is typical of nearly every consultation process taken by the HSE under this government. They are simply ticking the boxes, going through the exercise, and it doesn't constitute a genuine engagement with the community, the medical professionals or the service users. I have to inform the Minister that the public are seeing right through this tactic and it's achieving destruction of faith and trust in the local HSE management in this country. The government have actively undermined the ethos of the Vision for Change, a policy built on recovery model that recognises the necessity of collaborative relationship between service users and the medical professionals. Not only that, but the policy itself envisages that service users will be included in the policy formation and the decision-making process. Instead, the National Service Users Executive, set up under the Vision for Change, who represents service users, recently recounted to me how they have been bullied by the HSE to the point that they can no longer function. Indeed, last October I received a letter from the HSE that clearly stated that service users participating in meetings with the HSE would not receive equal treatment as medical professionals or other public servants. And this is in flat contradiction to the letter and spirit of the Vision for Change and fundamentally undermines the parity of esteem, the essential aspects of a recovery model. Minister, I recently met with representatives from the mental health reform. They expressed frustration at the delays in the delivery of the promised health funding in 2013. The HSE's National Service Plan in 2014 indicates that a certain initiative, including the appointment of new staff, the community mental health teams allocated for 2013 and 2014 will be, I quote, specifically targeted to the latter end of 2014. Savings to be utilised on specific services by a timing delayed basis. As Shari MacDidoff of the Mental Health Reform has said, and I quote, unfortunately, mental health needs do not operate on a time-delayed basis. And the decision to delay until the latter half of 2014 and the appointment of next year's promised 250 to 280 staff and the remaining staff due for 2013 will have a real human cost. Yet again, we are seeing mental health services suffer by the drip-drip effect of delays. That was her quote. Only yesterday, I received a response to a question I asked the Minister in September 2013. and it confirms the government's deliberate policy of delaying the recruitment of new staff in mental health. And as of the 30th of November of last year, only 137 of the 459 promised staff had been filled. Minister, how many of these posts are actually working on the ground? Because the question remains unanswered. These posts are part of a commitment given in the programme of government to ring-fence €35 million for mental health spend. This promise was betrayed in Budget 2014 when a cut of €15 million was imposed on the service. There is still no clarity to how much of the €35 million allocated in 2012 and in 2013 was actually spent Cathaoirleach. From talking to those on the front line in mental health services, information provided me by parliamentary question, I strongly suspect it hasn't been spent. The cut of the €15 million to €20 million in last year's budget, the ring-fenced amount, may simply be the government recognising the magnitude of the underspend that has already occurred in mental health. The mental health services are struggling to be kept alive. They're being starved for resources. Only recently, those working in mental health services in East Galway told me that the HSE's expenditure service plan in that area last year experienced a €3 million underspend by the end of October of last year. And they fundamentally believe that not one red cent of this money will be spread across the mental health budget. The Minister needs to confirm if this is the case and provide an explanation for that. At the end of September 2013, Minister, 413 children over a year on a waiting list for an appointment. That's 413 children in some level of mental distress, waiting over a year to be seen. The demand for child, adolescent mental health services is running 13% over anticipated service levels. At the same time, research published by the Royal College of Surgeons in Ireland shows that children and young people in Ireland have a higher rate of mental disorder than anywhere else in the European Union and the United States. There are individual and collective tragedies waiting to happen, and here, Minister, or whoever is running the scheme, they need to be addressed as an issue of urgent priority. My own belief is that issues arising from mental health and the health service have two key related causes. The first is that the department is weak, unable to properly manage the budget, suffering from a lack of confidence and a lack of political support from the Cabinet, and the lack of ability to manage and control department expenditure. A back-of-the-envelope approach in taking to the budgets and service plans has severely undermined public confidence. The farcical nature in the so-called probity measures, targeting savings from medical card schemes, the reduction of the figure from €113 million to €23 million, and the miraculous appearance of €108 million in unspecified savings. Other savings from payroll are only an example from which we have a catalogue of many. The second is perhaps the most significant. Just who, Minister, are you listening to? It doesn't appear to be the DG of the HSE, given the creative editing of Mr O'Brien's comments. To be fair to Mr O'Brien, he seems to have a rare gift of telling it as it is. He bluntly told Cabinet, I quote, "It will not be possible in 2014 to fully meet the growing demands placed on the health service." However, someone seems to have decided that this might alarm the public. So when the service plan is published, we must change it. It will clearly be very challenging in 2014 to meet all of the growing demands. The Minister, we have to listen to the front line. Observations or complaints from medical professions, their unions, their professional bodies, they are being ignored. And at worst, the messenger is being attacked. It's not enough to send the department to nod with the front line and to agree and empathise with them. We need to see action, and this isn't happening, I'm afraid. Minister, I know you're a listening man, but we need to listen to what patients and service users are saying. I have, and I call on them to ensure that they demonstrate, particularly your own officials, the confidence in the HSE management and confidence in the Minister to demonstrate that in a process and an engagement. Minister, I can tell you that morale within the health service is poor. It's very poor. And eventually, it's going to have an effect on quality, delivery of service and the patient. Currently, it's not just good enough to listen to people. We need to see action, and it's essential in the public interest that we start to engage properly with the service plan production, and genuinely that we work together with sincere objectives to ensure that we achieve outcomes in the interest of the citizens of this country.
Thank you.